This is my mother. A few years ago, she had a routine surgery and woke up a different person. For days, she saw monsters coming out of the walls, thought the staff were trying to kill her. She was terrified, suffering from postoperative delirium, the most common post-surgical complication that affects 23% of patients over 60, with serious long-term consequences, six-fold increase in nursing home admissions, 38% continue with long-term complications like dementia. And so to give you some perspective of the size of this problem, it's 60% more expensive to healthcare in the United States than diabetes. For hospitals, it's an average cost of £6.5 million per hospital per year, and that's mainly through a dramatic increase in length of stay. What we know from literature and from studies is that once a patient has delirium, there's not much or anything you can do. It's not treatable, but it is preventable, and prevention is highly effective. The problem is these preventive measures rolled out to all patients is just not feasible. There's not enough time and resources. So our solution was to use AI to develop an algorithm that would run pre-surgically, allowing for a risk prediction and targeted prevention on high-risk patients like my mother, which would dramatically reduce costs and improve outcomes. Everything you see here runs in the background automatically, extracting routinely collected data from the electronic health record and delivering a stratification of that risk, which is then communicated to all the relevant stakeholders automatically throughout the hospital, pre, during, and post-surgery that need to know. Beyond the software, we help with effective management of delirium. This includes online training and resources to the relevant stakeholders, as well as data analytics to help administration see what's actually happening, what's the change. And this is an example of a recent integration in a 300-bed hospital where we saw in a month 126 patients with delirium. Those patients stayed twice as long, mortality risk increased tenfold, ICU stay fourfold, and nursing hours fourfold. So in just a month, we were able to reduce length of stay by almost a full day, resulting in a cost savings of £440,000 per month. We are currently live in the United States, Belgium, and Switzerland with a healthy funnel of interested hospitals, and we've been very fortunate to win several innovation awards. Most importantly behind this is Nayeli, an anesthesiologist, Ben, a scientist, and myself, a serial entrepreneur, the founding team, with an incredible multidisciplinary team supporting us. We're currently raising £2.5 million. We have half committed. And our mission at PIPRA is to ensure that our loved ones, people like my mother, leave the hospital better than when they arrived, not worse. Thank you so much.